All right, hello everyone, and welcome to today's COVID-19 Planning and Response Office Hours. My name is Natalie Matthews, and I'm just going to spend a very brief moment going over some housekeeping and logistics with y'all before we turn to our great speakers and content for today. So this event is being recorded, and a copy of that recording along with the slide deck and a copy of the chat content is all going to be posted to the HUD Exchange within typed into the chat box right now a link to where you can find those materials if you'd like to access them at any point. And we've got all the materials from previous office hours, webinars, everything COVID related is up there on the site now. Additionally, if at any point you are having audio issues, we have found that phone audio tends to be a little bit more stable and clear during these webinars. So if you'd like to go ahead and to call in and switch from computer to phone audio, you can do that with the information up on the screen. And I have also put that in the chat for you in case you need that later on. All participants are going to remain muted for the duration of the webinar today so that we ensure that we're just hearing from the panelists and the speakers, but we absolutely want to hear from you throughout the course of the webinar and very much so encourage you to send in feedback, comments, questions, anything that you have for the team into the chat functionality in WebEx. So if you're new to WebEx or need some help finding WebEx, you can look on your screen and you'll see a row of icons in like the center of your screen. One of them is going to look just like a chat bubble. And if you click on that, that'll open up the chat window for you, which you can expand or enlarge on the side of your screen if you want to make the text a little bigger. When you are sending in those messages, and again, we really do welcome those for the duration of the webinar, please make sure that you are submitting them to all participants. That makes sure that it goes to not only attendees, but also to the panelists that we have with us today. So it should default to all participants. But if you're not sure if it's defaulted or want to just take a minute to check, you can just look in the drop-down menu on your screen and you can see that information. And with that, I'm going to turn things over to Norm Suchar from HUD's Office of Special Needs Assistance Programs. Norm?
Thank you very much, Natalie, and welcome everyone to the office hours today. I'm going to quickly introduce our presenters and the various people you'll be seeing and hearing from or reading from during the session today, and then we'll jump right into our presentations. So from the Office of Special Needs Assistance Programs, the SNAPS office, you have myself, Norm Suchar, Lisa Kaufman is on the line, Brad Esters, Marlisa Grogan. Also from CPD, we have Erin Weaver, who's in our Chicago field office. And we have a few technical assistance providers on the call today. Derek Lentor from CSH, John Gilvar from Gilvar Consulting, and David Canavan from Canavan Associates. And Derek and John will be presenting about some new technical assistance resources we have available. We're very pleased to hear from the state of North Carolina, Denise Newnaber, who's the Executive Director of the North Carolina Coalition to End Homelessness, and Laura Hogshead, CEO of the North Carolina Office of Recovery and Resilience. They're going to be giving a great presentation about some of North Carolina's work, the Back at Home Initiative, and a few other things. So we're very excited to hear from them. Moving on to the next slide. We have Barbara DePietro from the National Healthcare for the Homeless Council, who's on, Dina Hoosier from the Department of Veterans Affairs, Jillian Weber, also from the Department of Veterans Affairs. And they're available to answer any questions you may have. As Natalie mentioned, go ahead and type your questions in the chat box. You can feel free to type them at any time. We will answer as many of them as we can. So let's go on to the next slide, please. With that, I'm really pleased to turn things over to Denise and to Laura. So Denise, take things away.
Thanks, Norm. So let's see, we created Back at Home after Hurricane Florence hit North Carolina in September of 2018. So the we is a long list of partners for folks who saw a gap in disaster assistance and wanted to fill that gap. And so for us, that was really people who were not eligible for who had been impacted by the disaster and were not eligible for FEMA assistance or other assistance. So that really was folks who were precariously housed, they didn't have a lease, they weren't homeowners before the storm, or they were experiencing homelessness before the storm. And so what we did is we followed Houston's kind of their pioneering direction of the work that they did after Hurricane Harvey, and we used a rapid rehousing approach to recovery from the storm. And so we were working on, as disaster shelters were closing, we were working with a population that had no other path back to housing. And so what we did is we really thought about it as a rapid rehousing approach, not necessarily a rapid rehousing program, but we took what we knew worked from rapid rehousing, everything from the financial assistance, the housing stabilization case management, and we put that into a new program that covered 28 counties, and we were able to really build that in a different way than we had ever built anything, quite honestly, in North Carolina, in a way that really built some infrastructure for our state. And so that's what I think we wanted to share today, of both the infrastructure that we built after a previous disaster that we actually used again in 2019, for Hurricane Dorian, though that one had much less impact. We have a couple of households that we think will be housing through Back at Home from this latest hurricane last week, and we're using that infrastructure to now also launch the program for a COVID disaster response. So if you'll go to the next slide, this outlines a little bit of our thinking when we're thinking about the design. And so I will say that in responding to a hurricane, there is a lot of infrastructure for disaster that has already been created that we are able to tap into. So we're able to tap into the Red Cross helping us operate our shelters and some of their recovery programs. We're able to tap into FEMA and their housing assistance. There's a lot of pieces now that we're operating with, all of us, with COVID, that we may not necessarily have the same infrastructure that we had in disaster. So I know we feel like we're building a lot more infrastructure this time around, and we're trying to figure out how do we make sure that we put different layers in place. And so for us, when we think about folks who are at risk of becoming homeless and people who are experiencing homelessness now, we know for us, in the homeless field, we want to stay really targeted to the work that we've done over the past decade of really honing in on knowing how to serve folks who are experiencing homelessness, getting them back into housing as quickly as possible, and really identifying people who are at the front door of our system. And I think this disaster has really challenged us to think about how do we think about what has honestly become somewhat of a little bubble, that we've been protective of our resources and really prioritized our resources to folks that we know need it most. And we continue to believe in that, but we know there's also a possible large wave coming to our system that we want to prevent. And so when we think about that, we kind of envision that as this funnel, where how can we use these different pieces to reach as many people as possible and prevent them from having to come to our system, really even getting to that stage of homelessness prevention. So we think about, in our advocacy efforts, both at the federal and state level, we think about that first layer of protection of just those economic impact payments that are going out to households to help them with income. Of course, unemployment benefits and the extension of unemployment benefits, so important here. Then we think about emergency rental assistance, and this is, really for folks that are in rental housing struggling to pay rent. With all of these kind of yellow-orange lines are things that we think about putting a layer in place in the funnel to stop folks from falling down kind of that slippery slope for losing their rental housing. So we're trying to figure out how do we create these different stops basically, so people don't keep fighting down. And we know that for many folks, those interventions would work. Unfortunately, right now, we don't have a financial resource for broad emergency rental assistance. And so what we're really looking at is doing targeted rental assistance, which looks more like than eviction prevention. So for folks that are really showing up at the courthouse front door of folks that are, that their landlord is filing for eviction and we know that it's imminent. And I'll come back and let Laura talk more about eviction prevention and how that's starting to shape up in the state. We know that eviction prevention population is larger than who will actually show up at our front door for the homeless system. We know that preventing an eviction does not necessarily mean that you're preventing homelessness. It does mean that you're preventing them from losing their housing, and especially now it's so important that we keep people in safe, healthy housing situations. And we know that everyone is financially stretched. The supports that folks may usually rely on, we are worried about the family and friends that they may normally stay with before presenting to our system. What does that support system look like? But we do know that they may be there's just a slight difference here, and really it's about situation and I think need. So we're focusing our state ESG CV funds. We've made the decision to focus that money really intently on people who are experiencing homelessness, definitely targeting our non-congregate shelters, that we're using FEMA funds to make sure that we are protecting high-risk individuals. And then we're also looking at those high risk, our first priority, both for homelessness prevention and people experiencing homelessness, is people who have a high lethality risk. So we're really looking at medically vulnerable for that population. But we've decided we wanted to really look at CDBG CV that we know could also serve our population, but we want to look at that kind of broader scope and make sure that there's something in place to prevent those evictions. Laura, I'll ask you to share a little bit more about what the state is doing to create that piece.
Sure. Thank you, Denise. So we are in the midst of planning this right now. So I will say that most of what I'm talking about is pending approval from HUD, from the CDBG office. So I'm going to put a plug in I'm going to assume we're getting approval on all these things. They have been working really well with us because things can't work the way they've always worked with CDBG. North Carolina is typically a state that passes through CDBG funds to local governments, as most states do, without a lot of direction on how to use those funds. What we have elected to do for Tranche 2 and Tranche 3 of the CDBG CV funds is to run that from more of a state-centric approach and to target it very narrowly on eviction prevention, utility assistance, because it's not a lot of money. For North Carolina, Tranche 2 is $28 million. Tranche 3, we assume, will be about the same amount. And Tranche 1 is going to be more like traditional CDBG. But Tranche 2 and 3, we really want to catch folks at the point that they are most vulnerable, and we're doing that by working very closely with our ESG folks, by working very closely with Denise and with DHHS in North Carolina, to make sure that we are using the same delivery system, that we're catching folks in that funnel. We're not asking individuals to figure out what they're eligible for, that we are asking intake agencies to figure out what they're eligible for and then putting them in the right bucket of funding. And we really want to focus on the arrearages, the up to 3 months of arrearages that HUD will allow us to pay. We have asked for extending that, so that is on the horizon, hopefully, that we could extend beyond 3 months, because we know that folks have more than 3 months of arrearages. This has been going on for more than 3 months. And we want to make sure that we catch the utility payment as well, because you have to have running water in order to keep yourself safe from COVID. You have to be washing your hands. So it's a new thing for us. It's a new way of doing this for us. We are planning to work through the same nonprofit entities that ESG is working through, and so that we are catching folks at that front door. And if you aren't eligible for ESG, you probably are eligible for CDBG CV, and that determination would be made at the door that you show up, right? You don't have to figure that out on your own. So that is the path that we are taking right now. It is not a path that has been tried before for North Carolina, and so we're desperate to learn the best practices from other folks. We are shameless copycatters of other good programs. We are taking liberally from the work that ESG has already done and trying to add in and not have competing programs, not have any daylight between us, so that the organizations that we work with find it as seamless as possible to work with these two funding sources. So I'll turn it back to you, Denise.
Thanks, Laura. Let's go to the next slide. So when we think about these programs and what things they fund, they are very similar, but we think about eviction prevention really as the rental assistance, utility assistance, rental and utility arrears. We also have some separate programs that are happening around mediation for eviction prevention, and also, of course, we tap into legal aid and other legal aid services. So we know legal services may be needed in any of these pieces, but I think what's notable about how we're thinking about rapid rehousing and prevention is that we're attempting for the households that we serve with Esgcd funding that the prevention and rapid rehousing households may not really look that different. It may really just be, as you know, the big difference may be what was your housing situation last night. But we think it's really that households need the same things, that obviously the financial assistance, and we think a lot of them we're not going to be preventing them from leaving their housing. We may really be preventing them from unstable situations and making sure that we're finding them new housing. So a couple of things I want to just hit on this slide to share some of what we've found has worked. And I think the thing that has worked the most with Back at Home is that from day one, it's always been about problem solving. How do we do this? It's not if we should do it, it's how do we do it? And it's also been, I think, really intentional about how do we go quickly and how do we provide support to our rehousing agencies, the ones that are doing the real hard work of getting individuals and families into housing. What can we at the state level take off of their plate so they can go faster and they can serve more folks? We know the scale we're trying to serve. We don't have the workforce to serve at the scale, at the speed we need. And that was probably workforce was one of our biggest challenges after the disaster, after the hurricane. Workforce, being able to make sure that we can hire up. And the other one that, I wouldn't have predicted was furniture, trying to be able to distribute furniture and household goods. But some things that we really noticed make a difference here. We've contracted with an inspector. So for Back at Home, we use HQS inspections. And so we've sole sourced a contract with an inspector that they turn around HQS inspections for us within 24 hours. So fast that it actually put pressure on us, on our systems and workflows to be able to go faster. That's made a huge difference for us to be able to not have the agency in charge of the inspection and just really have someone that we've tasked with that job. They give us the inspection even if they fail, and they tell us what failed on it. And then we have some private money that we use to work with landlords to fix those problems. And so we don't have to pass on a unit because of something like windows are sealed shut. That's one we see often, or a bathroom fan is missing. So we're able to actually make some repairs and continue to use the unit. So that private funding for repairs and also the sole source contract with the inspector has been really important. We also have taken a lot of the paperwork burden as much as we could. I'm sure they would like us to take even more off from the rehousing agencies, but we've taken some of the paperwork burden off of the rehousing agencies. So we have a workflow where they can send, hey, we're looking at this unit, and within that day, they're getting back from our partners at Social Serve now. It started with the Housing Finance Agency. They're getting back whether it's within FMR or rent reasonableness, whether they've passed a state debarment check. So all of those pieces are kind of done someplace else where we've really been able to streamline and find some efficiencies. We also have some private money that we're using for move-in fees. This has been particularly helpful for households that have been harder to house, in that we have a $500 move-in fee, and with that $500 move-in fee, landlords are waiving what may appear as bad credit on credit checks and making allowances for criminal history that they may not otherwise. And that's really been a negotiation with the rehousing agency, but putting some money and putting some training and an intention in that has been really helpful. Same thing with barrier busters costs, just, figuring out what is between you and getting into housing, and we're making sure that we problem solve around that. Let's go to the next slide. This is this has been a really strong and large partnership. We've called on a lot of different partners to help make this happen. The last one you see listed here is really the foundation of the program, which is the rehousing agencies. Most of them nonprofits, some of them local units of local government that are providing the rapid rehousing and homeless prevention services. In support of them, in order to be able to help them move as quickly as they can and manage things like cash flow, when you're housing so many people so quickly, we see some of our agencies start to really, sometimes they would slow down just not having the cash that they could write the checks and get reimbursed. So on the state side, our state partners have worked really hard to make sure that reimbursements are going quicker and that we were able to front some funds with state money, and we're hoping to do that again this time. The North Carolina Department of Health and Human Services is the Esg recipient, and they're the back-at-home administrative agency. So that was true for Florence, and that'll remain true for COVID. Our Housing Finance Agency handles requisitions. They've built a portal that's super helpful to get those payments made weekly to agencies, and they also help us with reporting. I think what's real different for us with back at home is I can check a dashboard at any time, and I can see where we are on moving folks in. I pull it up on my phone and I can see where we're moving. That's so different than what we've had with other programs where there's been a delay of information. And as we move forward with COVID, we're really looking at balancing between prevention and rapid rehousing, and we'll be able to use that data to know where we need to surge, and each community is looking at where to surge and how to do that, and setting some local priorities within our overall prioritizing. I think one piece that's been helpful is that we're not all doing it on our own. We're really bringing all those great minds together and creating it together. So we are, for back at home COVID, North Carolina has 100 counties and 90 have opted to use this state infrastructure. 10 counties or 4 COCs have local infrastructure that they feel like they can go faster with, and this is all about housing people quickly and housing them well. And so for the 90 counties, we will be using 211, like Laura said, as that first entry point, where they're going to be doing housing stability triage, trying to figure out which program you might be helpful for. They've actually been trained in diversion, so they'll be doing some diversion conversations as well. We're working with you can see here several partners that are just helping us really design it and make sure that we're thinking through supporting our agencies, providing a lot of coaching and training, and thinking through program design. Let's go to the next slide. Driving this work, these are several underlying assumptions that we're making. We are all in agreement that rapid rehousing is an intervention. And when we say rapid rehousing, we think about that again as an approach, not just the program, but that we'll be doing those rapid rehousing activities, both under prevention and in rapid rehousing. So we really believe that that can work for everyone, even folks in need who ultimately may need PSH. And that's what we did in the after Hurricane Florence, and that's what we'll do now. And then we work on exit plans. But I have to say, after Hurricane Florence, there were people that from the beginning, people said, we are going to have to figure out PSH for them. And you know what, we didn't need to. And so I think it really is about getting folks into housing, figuring out how they stabilize, what other things you connect them to. And we really think about creating PSH, not just with COC PSH dollars. We love our COC PSH dollars. They aren't enough. And so we work on creating that with other vouchers, with other services through Medicaid, that type of thing. We know that we want to have diversion and rapid resolution conversations happening with 211 and at rehousing agencies at intake. We've just believed so much in the difference that can make. We want to make sure that that's happening. We also believe that that prevention has to be really well targeted, and that we know we're expecting an increase of these households coming into our system just the beginning of this month with unemployment benefits ending and, a new month turning over with rent. Our 211 saw more or increased requests for rental assistance. So we know the need is there. We want to make really sure that we're targeting that prevention, that we're not only doing rapid rehousing, but we want to prevent folks from coming into the system. We just want to make sure that we are targeting those who are most likely. And then, it's really about making this easiest for the client and for the rehousing agencies, getting done what we need to get done and keep moving. So you'll see that just kind of throughout our program. Let's move on to the next slide. So we are launching in August. That's next week. So at this point, the state has done an RFA and selected rehousing agencies, and next week we're launching a lot of different training calls where agencies are getting up to speed on new processes. We're doing a lot of coaching. That was one thing with Hurricane Florence work that we found that we were able to really strengthen our rehousing agencies through working together and creating cohorts. So we'll be doing that throughout the program. Next slide, please. We have a few different web pages that may be helpful for folks. This first one, Back at Home, that's our public-facing website. So that's really going to be for a very quick explainer of the program. We had to have a place once we launched Back at Home for folks to know about it and go, but what I think you guys will probably be more interested in is these next two pages. So to find out what our state is doing with what they've done with the Esgcd dollars, and of course Esgcd dollars, this is only a portion that's going to Back at Home. We're also using it for shelter, for increased street outreach. Communities have made that decision about how much money they want to invest in rapid rehousing, homelessness prevention versus those crisis response activities. And then as of next week, when we start our trainings, we'll be putting them on our website, all of the recorded calls, all of the materials. So if folks are interested in those, you're welcome to visit the NTCH website, and everything will be there. Norm, I think that wraps up the information I wanted to make sure to share, and I'm glad to stick around for questions at the end.
Great, Denise and Laura, thank you so much. We do have a few quick follow-up questions that I wanted to ask. So you talked about a $500 move-in fee that you use private dollars for. A few people had a question about where that came from. Can you talk about what sort of non-federal sources or more flexible sources you were able to use?
Yeah, so for Florence, we had funding from Healthy Blue, which is our state's which is Blue Cross Blue Shield's Medicaid offering in North Carolina. So that's mostly where we were able to do the move-in fees. We also had some Red Cross money that we were able to do some of those barrier busters and more flexible pieces. And the $500 it's a kind of a simplification because we actually have room to negotiate with a landlord of what that is. We've been working with Clutch Consulting on that program. I would really recommend some of their resources of thinking about how to engage with landlords differently. And for us, we've been moving from a one-by-one unit strategy to really recruiting a large number of units and working with landlords in that way. So it's a evolving process for sure. There's information about, I believe there's information on our website as well about that what we call our housing connections or Healthy Blue money. I'll find a link and put that in the chat for folks.
Thank you. We also had a couple questions. You mentioned you have a dashboard. People were wondering what platform you used for your dashboard.
Yeah, so we used Smartsheet, a program called Smartsheet. We use them for a lot of different things. We built that out. I will also say all of the data is in HMIS, but we did have for Florence, we had one DV agency, and so it was really cool to be able to have a different system that we could get data from very quickly. And quite honestly, our HMIS, we couldn't build it quick enough for the data that we had. So I can, there's also I'll see if I can find a place with a view that you guys can see the dashboard. We are doing something different for COVID. We're using Unite Us, which is a software company that we use. NC Care 360 is a local, it's very similar to coordinated entry, a little bit differently, but we'll be building it with that system in Tableau.
And last question before we move on, you mentioned the challenges with the workforce, right? Identifying people to actually do the housing search and all the other stuff. So what do you have tips for people? Because I think this is a pretty common struggle. But do you have suggestions for how people should address that?
That's a great question. I think we started to pay more. So that was one thing, especially after disaster. We were making sure we were paying a little bit, paying more. And I think without being one that has hired those staff myself, I think what we found is really what was essential was providing the training. What we've done is we've adjusted everything with training, knowing that we're going to have turnover, knowing we're going to have folks joining, and really trying to make sure that it's not just what we like to do in our field, a lot of oral history, of like learning by oral history and following me, of that we're trying to think about training in a different way. And that's what we're doing with training and field support, where every training we're doing, we're recording it so new folks who join can go through that. I think it's always when you're looking to hire, some of it is making sure that you're hiring folks that obviously that have good client interpersonal skills, folks that are willing to try new things, and really problem solvers. For me, that's the biggest thing in our field that we need is problem solvers and people who are able to really hone in on the problem and help people come up with creative solutions.
Great, thank you. So we're going to move on. We have a couple new technical assistance resources we want to highlight. I will say we have many more technical assistance resources on our website on the HUD Exchange. So you can always visit hudexchange.info to see the latest and greatest documents and resources we have to help with CARES Act implementation. But we're going to highlight a couple of these right here and now. So I'm going to turn things over to Derek Wentorf, and he's going to talk about a new document that's not quite posted yet, but should be up early next week on case management ratios. Derek?
Great, thanks, Norm. We can move to the next slide. So this document that's going to be coming out, like Norm said, I think early next week, is really meant to provide communities with a foundation for what kind of case management ratios they should be looking at as they're starting to ramp up responses in their community. And so there's a lot of information pulled from a number of different sources that are all going to be quoted in the document once it's released. But it does touch on both community-based case management as well as housing-based case management, and then a number of different housing interventions with different ratios. This is really meant to be a starting point for your community. So not necessarily like follow this as a script, but do bring it into a conversation of, as you're beginning these different programs and looking at funding sources, what are the things that are unique in your community that might need some of these ratios to pivot? So we can go to the next slide. So really simply, again, this isn't rocket science. This is a lot of what folks I know understand in their communities already. But as the intensity of services decrease, the caseload ratios can increase. And so when we look across the different examples that are highlighted in this product, it really gets into some of the ratios are based on some models that are connected to fidelity, and others are just kind of information that we're pulling from different sources. So it really varies on the number of folks that you're going to be accompanying in case management. But the basic rubric is that as you decrease with the intensity, the more people you can serve. We can go to the next slide. So this is an example of the information that's put in there and broken into the different target populations of individuals, families, and transition age youth. And then on this matrix, you look at what are the interventions on the community-based model that are much more intensive and therapeutic, and then moving all the way through towards more broad-based system engagement and support. And so again, I can't reference this enough. This is really meant to be a starting point for your community. How does this resonate with what you already have funded in some of these places, and what can you revisit and think about a little bit differently as COVID is uniquely impacting how services need to be provided. So we can go to the next slide. So as we look at housing-based case management, there are a number of different matrix that we're going to kind of walk through. There's just going to be one example on the slide today, but as the product's out, you can dig into them yourself. Moving from critical time intervention to more intensive case management, some basic tenancy support, and then what we're calling disaster recovery and workforce housing. All of those have different levels of intensity, and thus the ratios change a little bit. And also, when we looked at the different housing locations and the different housing types, we looked at scattered site, single site, and then a combination of either caseloads that are pretty stable and have been there for a little while, and existing programs. So there's also some information in here about diagnoses. And so the ones that we were able to reference and find some ratio information on are substance use disorders, serious mental illness, intellectual disability, and developmental disability. So we can go to the next slide. So this is an example of one that we pulled out that has to do with intensive case management caseloads. And so walking down through the different target populations, you can see here on the slide that for the different ratios, depending on if you're scattered site or if you're on a single site, or if it's been a housing program that's been in place for a little while, we give a little bit of foundation, and in the document itself, it'll reference back to the points where we pulled this information from. So that's a really quick sneak peek of what's going to be coming out next week. So you get to see stuff before it's actually posted, but do come back to HUD Exchange and that stuff will all be up there. I think that's it.
Great, thank you so much, Derek. We have another document about healthcare partnerships, and I'm going to turn things over to John Gilvar, who's going to talk us through that. John?
Thank you, Norm. Hi, everybody. So I'm going to briefly walk through how the newly published Operational Healthcare Partnerships TA document may prove helpful to COCs, ESG grantees, local and state governments, and individual homeless services providers and healthcare providers. The first slide here provides a starting point for the guidance. The problems listed on the left side are those that have been facing homeless services systems, public health departments, hospitals, healthcare for the homeless agencies, and others that play a critical role in the pandemic response. These problems are ongoing, regardless of how much a given community has flattened the curve in virus transmission. Then on the right side of the slide, it speaks to the ways that communities across the country have developed highly coordinated approaches to mitigating the problems. So in researching the solutions created in the various communities around the country, our team that developed this TA document identified 3 common success factors that are listed here. They all have to do with quickly ramping up highly focused collaboration around systems, across systems and across typical strategic planning silos. Next slide, please. This slide shows the kind of ways that the document, the TA document here is, it's chock full of hyperlinks to examples of how collaborations involving COCs, ESG grantees, public health departments, and other partners either adapted existing programs or created completely new programs to accomplish the goals laid out on this slide. You can see those different goals: enhancing collaboration and real-time information sharing, protecting the most vulnerable to serious illness, maintaining access to medical behavioral health, harm reduction services, and then mitigating virus spread. Okay, next slide, please. So on the left side of this slide, you can see some of the specific steps that various communities have taken to respond to the complexity of reducing the risk for homeless services providers, people staying in shelters, people living outside, people exiting hospitals and jails, and then also people who have exited homelessness into housing but have the underlying health conditions that elevate their risk for serious illness and death from COVID. And all of these steps result in increased coordination and information sharing. And then the guidance contains links to web pages that show how these steps have worked well in cities like, or communities like Atlanta, Seattle, and other places. And then the right side of the slide shows examples of partnership-based solutions to some specific challenges of protecting people with elevated risk, challenges that have to do with their older age or their underlying conditions, challenges that have to do with the barriers they have to accessing healthcare or accessing safe places to recuperate from serious illness, hygiene facilities, transportation, and other resources that many of us take for granted. So the guidance links to examples such as Alameda, California, where non-congregate protective lodging was quickly stood up in a hotel through a partnership among the Healthcare for the Homeless program, the COC, the County Healthcare Services Agency, and a housing provider. And there are other links in the document to different approaches to non-congregate shelter in Chicago, New Orleans, Albuquerque, and other cities. And then next slide. So finally, the guidance provides examples of how collaboration across the housing and health sectors is reducing the chances of rapidly spreading outbreaks like those that have occurred among people experiencing homelessness in Boston, San Francisco, and Seattle. It links to sanitation guidelines, training material, and infographics that communities have developed specifically for homeless services providers. It has links to innovations such as two teams in Seattle, which really interesting. There's a FAST team and a CAT team. So the field assessment support and technical assistance, or FAST team, was developed by the Public Health Department in coordination with homeless services agencies to provide comprehensive education and training related to cleaning, disinfection, social distancing, hand washing, and other hygiene issues to minimize COVID-19 related risk at shelters and other congregate sites. And then the CAT team, the COVID-19 assessment and testing team, was developed by NeighborCare Health, which is a federally qualified health center, in partnership with shelters, supportive housing providers, and the Public Health Department. And it provides on-site testing. It can respond to clusters of cases, for example, in shelters and other congregate spaces. And it also coordinates with the isolation and quarantine units that have been established for symptomatic or positive COVID-19 patients who have no place to self-isolate on their own. And just as an indication of adaptation or an example of adaptation, this CAT team was developed building on Seattle's Housing Health Outreach Team, which stations clinical staff in shelters and other housing sites. Lastly, the guidance links to examples in LA and other communities of intensive and rapid planning to accelerate housing placements, similar to what we heard from North Carolina. The examples here focus mostly on rehousing people quickly who are the most vulnerable right now because of their underlying health conditions or their age. So there's some great examples there and links to documents that should be really helpful for other communities that are planning accelerated permanent housing for that kind of population. Thank you very much.
Great, thank you so much, John. We have a few more slides that are just resources that we want to make everyone aware of, some of the new resources posted to HUD Exchange. One thing I do quickly want to point out is for Continuum of Care grants, for the 2018 grant agreements, we published a series of sort of sample grant agreement amendments. So if people wanted to make very quick amendments to their 2018 COC grants, they could sort of fill out a canned form, and it was very easy and streamlined. We now have those posted for the fiscal year 2019 grants as well. So please go to the website and you can, if you need to make an amendment, for example, to move some money around that's related to COVID needs, it's very, very simple and straightforward. And Natalie has posted that in the chat box, so you can quickly get to that link. So we'll go to some questions now. So I want to start with some Esgcd related questions that people had. So Marlisa, I wonder if you could take this first question here. HUD provided guidance in March for expending ESG funds due to infectious disease under the outreach and shelter categories. Are those the same expenses that are eligible under rapid rehousing? Can you just sort of talk about the differences in some of those activities, particularly what supportive services are eligible under each?
Sure. There are differences in the type of services that are available or eligible under emergency shelter and street outreach versus rapid rehousing and homelessness prevention. For emergency shelter in particular, there are outpatient health services, child care, education services. Other things that are more related to COVID response include PPE, other shelter operations costs that could be used for infection control measures and increasing sanitation and cleaning. But then, like I mentioned, PPE, other shelter operations, equipment, utilities, food, other supplies that you can use for cleaning, and then mental health services, so transportation. So emergency shelter is a lot more service heavy than homelessness prevention and rapid rehousing, which is really limited to housing focused services like housing stability case management, housing search and placement. There are some other financial costs like moving costs, utility payments, but you can see that when it comes to COVID response, the services that are eligible under shelter and street outreach that are more health oriented and sanitation, PPE, whereas under rapid rehousing and homelessness prevention, those are not eligible.
Great, thank you. And Brett, we have another question about using Esgcd funds. The questioner is asking, what is the earliest date to reimburse costs under Esgcd? Obviously, you can reimburse them from the passage of the CARES Act, but can you talk about when someone would be able to reimburse costs that occurred before the passage of the CARES Act in late March?
Sure. Certainly stay tuned for the notice. When it comes out, it'll give more detail. But in general, you're going to be able to go back and incur costs to when your community started preventing or preparing for or responding to coronavirus. So we know that the earliest case in the United States was diagnosed around end of January, I think. So that's the earliest we would expect, but that doesn't mean that that's when it hit your community. So whenever your community started preventing, preparing for, or responding to coronavirus is when we're thinking you'll be able to go back to.
Great. We had a couple questions about other COC stuff. One is about, and I can take this one, one is about the COC NOFA. What will it look like? When will it be released? Those are great questions. So the Congress is working, I'm sure you've seen in the news, working on potentially another round of funding and other authorities related to coronavirus. One of the things that has been included in a House bill that passed the House and a Senate bill that has been circulated is some authority to change how we do the COC funding process for 2020. So we're tracking that very closely. We can't really act on that until that's actually enacted. But what that would allow us to do is have a process where we basically just sort of renew existing grants, and there isn't a COC competition in the way we normally think about it. Now, I will say we did publish the grant inventory worksheets, the GIWs, for everyone to review and get back to us. We need that either way, like whether we run a competition or just renew existing grants, we need the information from those GIWs. So that's not an indication that we're sort of going to take one approach or the other, but we do need that information. So if you could please fill those out and get them back to us as soon as possible, that would be great. But again, we kind of have to wait and see what Congress does. If they enact something, then there's a possibility that we just run a very simple process where we just where you just submit like what grants need to be renewed that are already running, and then we just sort of award them as renewal grants. Also have a question about, there was a comment and question about the fiscal year 2019 grant agreements. We do have a set of grants that we still have not been able to process. We are trying to get those out as quickly as possible. I know it must be incredibly frustrating. These are grants that have some sort of domestic violence project embedded in them, either they're domestic violence grants or they're sort of expansion grants with domestic violence components in them, or new grants. So we are trying to get those done as quickly as we can. I am so sorry that it has taken so long, and those do include planning grants, by the way. I'm so sorry it's taking so long. We are trying to get all those issues resolved, and we will let everyone know as soon as those are ready. And we also have a question about whether some of the waivers are set to expire in September. We are very much aware of these, and we're tracking it. We don't have any news yet about what's going to happen with those, but we are certainly tracking those, and we'll keep everyone up to date as we follow those. We do have some more questions, Denise and Laura, about back at home that I'd love to ask you about. So one comment you made, Denise, about people that it was sort of when people looked at them, they thought they certainly needed PSH, but as you went along, you found maybe they didn't need PSH. So can you talk a little more about that? Like, so what happened, and what sort of resources did you embed in back at home for people who were who had those higher needs and indicators, like, you know, severe disabilities and long-term homeless experiences? What additional sort of things did you do to help serve them?
Sure. Yeah, I was trying to find the data on it to see if I could find out how many actually needed to exit to PSH, and I'm sorry I wasn't able to find that real quickly. We've housed just almost 1,600 people, and I think within that, so I guess context for the program is it was state dollars, and with state dollars, when the legislature approved it, they approved a 6-month rental assistance program. We interpret that as an average 6-month rental assistance program. Not everyone gets 6 months. And so we used a progressive engagement approach. And from the beginning, we were housing folks. I guess the other context for the program that's really important is that in our disaster shelters, there was actually a higher percent of people who had a disability than we see in our emergency shelter population, in our homeless shelter population. So normally in our homeless population, we see about 30% with a disability. In our disaster shelters, 50% had a disability. So it was a highly disabled population that we were serving. And so I think we all kind of, you know, made the assumption. We all at least were starting out with, well, we know we could start with rapid rehousing and then exit them to something else. So I think we were at least progressive in that way as well. But we really thought, you know, we're going to have to have PSH, additional PSH resources to exit people to. And what we saw is, I just think we're really bad at predicting what people need. That was one piece of it. You know, I could say, you know, there's all these anecdotal stories of one gentleman who had been homeless in his community for years, actually slept out in a tent during Hurricane Florence, came into the shelter after the hurricane, and within 2 months had, after being in housing paid for by the program, was paying his own rent because he tapped into some retirement that he didn't know about or hadn't access. So I just think that housing stability, in some cases you'll hear stories like that of just something else worked out that we could have never predicted. But definitely we were partnering with public housing authorities. I mean, obviously we were using units, public housing authority units, also vouchers. And some of it was, using the SWORD program, basically everything you can just to make sure that folks have some kind of income to pay for that. And of course, then also working on services. But for most folks, one of our rehousing agencies was our local LME-MCO, which is over kind of mental health, access to mental health services. So that was a real key piece of being able to access those services. But I think just overall, we had an extension request in place that if a household needed beyond 6 months, they could request it, but it really was just a handful of people who needed that. So I think it's a lot of, we were bad predictors, we worked along the way to find something else, and it's just a lot of those leveraging other resources.
Great. And so you said you didn't have data about how many people sort of moved on to PSH, but did you, were there other resources you sort of were you able to tap into vouchers and home funding or any other sort of longer term funding that you were able to connect people to that may not have been your COC PSH units, but certainly something that, could be helpful?
Originally, when we were designing it, we thought we would try to design something statewide like that as well, or at least 28 counties that you could tap into, but we ended up just not needing it. It really was existing resources. So some of it, yes, local rental assistance, some of it, again, through public housing authorities, some of it through COC, but it's hard to say now. We do think we're going to have to serve people for longer, obviously because of the economic impact, and think that our average length of service and participation will be longer. But we thought we would have to design something special, and we didn't.
Well, that's great. So let's see if we have other questions here. Oh, Denise, someone had a follow-up question about the dashboard. Can you talk about who has access to the dashboard?
Yes. So let's see. There's actually two versions. There's one that has rehousing agency identifying information on it, and that it's just the key partners, the ones that are listed on leadership and rehousing agencies that have access to that and the more detailed information. There is a more public-facing dashboard that we would often send to HUD, and I see Dave Canavan as one of our TA providers that we would often say, here's the snapshot. Some folks, that was a published link. We didn't put that, to be honest, when you're doing these programs, there's a lot of politics involved. So it's not one that we splash real pretty on a website and just have anybody going there, but we would send the link to partners. We would do, especially in the beginning, we were doing weekly just screenshots of it and sending it to partners like Red Cross and folks that were working with us on housing. We have not done yet a full public-facing, this is where we are.
Great, thank you. We had a follow-up question, and I'm sure there are going to be a lot of follow-up questions about my comments about a 2020 COC funding process. One follow-up question that I did want to answer is about planning grants. The language in the various congressional bills do address planning grants, so you would, be getting a planning grant. I know it's not strictly a renewal, but there is a provision for those, so we would incorporate those as well. So that's those are the major questions we have. We have a few more in the chat box that we're trying to answer. But I want to just take this moment to thank our presenters, Denise and Laura. Thank you so much. I've obviously been tracking Back at Home since Florence, and it's just, I think, amazing work. And I think just goes to show that, I know it didn't just spring up after Florence, that there's years of sort of education and advocacy and sort of building up systems and knowledge and infrastructure and processes that it takes, and you just sort of take advantage of your moments to implement. So I know that was just a ton of incredible work over many, many years. Just, thank you for sharing that with us. I'd encourage people to take a look at some of the resources Denise mentioned. It really is sort of an impressive model for both responding to disaster, but also really a model for how to do homelessness assistance in a very, very efficient and effective way. So thank you for sharing that. I want to thank Derek and John for sharing those great new resources. Thanks Natalie and the team and everybody for keeping the logistics going, and definitely want to thank the snappers on the call for answering questions and you know, all the stuff that makes the COC and ESG and CARES Act program work. And with that, we're going to finish up. I again want to thank everyone who participated and listened in. Keep your suggestions coming. I know many of you have shared recommendations with us, and we very, very much appreciate it. Please keep them coming, and thank you so much for all the incredible work you're doing to keep people safe, to make progress on homelessness in these incredibly trying times. And please keep up the good work and let us know how we can help. So with that, we'll close the office hours, and that concludes this webinar. Thank you.